Hi, class. We're on chapter 7, rhythms originating in the sinus node. Chapter 7 starts on page 72 for those who want to follow along in their books. Here's an image of your sinus node firing. And so the rhythms that we're going to be talking about are going to be originating from here in our sinus node. The objectives for this chapter will be to state the criteria for each of the sinus rhythms, using the 5 steps, correctly interpret a variety of sinus rhythms on single and double lead strips, state the adverse effects of each of the sinus rhythms, and state the possible treatment for the sinus rhythms. Okay, so sinus king. So our SA node is the normal pacemaker of the heart. So we call it the king of the conduction system. The sinus node gives up its control by either becoming ill of death or by being overthrown by a lower pacemaker. Sinus rhythms are usually regular and predictable, but they can be irregular at times. And your sinus rate is usually 60 to 100 beats per minute. Sinus rhythms are affected by the sympathetic and parasympathetic nervous system, and sinus rhythms are the standard against which all other rhythms are compared. So here's a look at your normal sinus rhythm. We see that we have our P wave that comes before every QRS. The rate's between 60 and 100. It's regular, and the PR and QRS intervals are normal. So the criteria for sinus rhythms, you have upright and matching P waves in lead 2, followed by QRS, and your PR intervals are constant, and your heart rate then is less than 160 beats per minute, which is your normal is between 60 and 100. Sinus bradycardia. With sinus bradycardia, we have a heart rate less than 60. Our rhythm can be regular. We have a P wave that comes before our QRS. PR interval is 0.12 to 0.20, and our QRS is less than 0.12 seconds. Some causes of sinus bradycardia are vagal stimulation. For example, a patient that's vomiting or straining to have a bowel movement, if that patient's had a heart attack or lack of oxygen, and some medications such as digitalis toxicity can cause sinus bradycardia. This is common in athletes, and the only difference between your regular sinus rhythm and sinus bradycardia is the heart rate. Okay, with your regular sinus rhythm, you're going to have a heartbeat of 60 to 100, and with bradycardia, it's going to be a heartbeat of less than 60. With sinus tachycardia, the sinus node fires a heart rate faster than normal. That heart rate is going to be greater than 100. And some of the causes of this is if you get angry or upset, patient can have congestive heart failure, COPD, and some medications can also cause sinus tachycardia. So a sinus arrhythmia is the only irregular rhythm from the sinus node, okay? The rate varies with the respiratory pattern, and sinus arrhythmias are common during sleep, especially with patients that suffer from sleep apnea. With sinus arrest, you have regularly firing sinus node that suddenly stops firing, and you're going to be missing one or more sequences of your PQRST, okay? So you'll get this long pause in between. So with your sinus exit block, the sinus node fires on time, but the impulse doesn't go anywhere. It can't get past that surrounding tissue. And some causes of that could be medication side effects, hypoxia, but your rhythm tends to return once your SA node starts firing back to normal, then your rhythm will return to normal. Okay, that's all I have for you guys today. Your assignment is going to be to state criteria for each of the sinus rhythms and submit your picture when complete. And I will see you guys next lecture. Bye-bye.